So what is Cushing syndrome? Cushing syndrome is a disorder that occurs due to abnormally high levels of the hormone cortisol. It is an extremely complex hormonal condition that involves many various areas of the body. Symptoms of Cushing syndrome. Some very common symptoms include weight gain and fatty tissue deposit in the midsection, upper back, between the shoulders, and on the facial region. Pink or purple stretch marks may appear in the arms, thighs, breasts, and abdomen. One may develop thin skin that bruises very easily. Acne is also very common with Cushing syndrome. Women who have Cushing syndrome may experience thicker, more visible hair, as well as absent or irregular menstrual periods. Men with Cushing syndrome tend to have erectile dysfunction, decreased fertility, and decreased libido. Other various symptoms include fatigue, muscle weakness, depression, anxiety, cognitive difficulties, high blood pressure, headache, and bone loss. Now, the doctors involved with Cushing syndrome. Many different doctors can help treat Cushing syndrome. Now, doctors involved in laboratory medicine and pathology can help you perform tests to determine if you have Cushing syndrome or not, and then they can help devise treatment plans based on your results. Now, an endocrinologist is trained to help with endocrine-related diseases, which Cushing syndrome is, and he or she will help maintain and improve the patient's overall health. A radiologist can help treat Cushing syndrome through radiation therapy, and a neurosurgeon can perform surgery if necessary to remove a tumor from the adrenal or pituitary gland. Now, some of the treatments of Cushing syndrome include surgery and radiation therapy. Now, if surgery is necessary, then a neurosurgeon will be needed to remove the tumors. Now, if the pituitary gland is the source of the tumor, then the surgeon can remove the tumor through your nose. Now, if the adrenal gland is the source of the tumor, then the surgeon can remove it through normal means or through minimally invasive surgery. Now, after the operation, one will need to take medications that supply the blood with the proper amount of cortisol. Now, if the surgeon cannot remove a tumor, then radiation therapy is usually a good treatment option. Now, therapy will be in small doses over a long 6-week period, and that will help get rid of the tumors. The prognosis of Cushing syndrome. If Cushing syndrome is left untreated, then the patient's condition will most likely worsen. Patients who leave their Cushing syndrome untreated only have a 50% survival rate. However, if one treats their disease with radiation therapy, then the patient will have a similar mortality rate to anyone in the general population. Within the first year of successful treatment, the patient will see great improvement on facial plethora and fat pads. The patient will lose a significant amount of weight and will be able to regain control of diabetes and hypertension. Now, patients will have increased bone density. Most of these complications will be resolved. However, there are a few exceptions to this, of course. Now, the body systems affected by Cushing syndrome. Of course, the endocrine system is affected with the pituitary gland, the adrenal gland, But we're going to be talking about how Cushing syndrome affects the digestive system and the cardiovascular system. Now, Cushing syndrome affects the production of cortisol, which is very key in regulating blood pressure and just helping the cardiovascular system function properly. So if there's an abnormal amount of cortisol, then the cardiovascular system can't function. Now, cortisol also helps with turning food into energy. So if there's an abnormal amount, it messes with that, and we just don't get as much energy. And yes. Now, what are some of the causes of Cushing syndrome? There are many causes, but the most common cause is the overuse of oral corticosteroid medicine. Cushing syndrome can also occur when the body just makes too much cortisol on its own. Now, the diagnosis of Cushing syndrome. Cushing syndrome is very tricky to diagnose because it has so many similar symptoms to so many other diseases. But if your doctor suspects that you have Cushing syndrome, then he can recommend various tests. He can perform various tests to help you determine if you do have it or not. One of these tests is a urine test, which measures the amount of cortisol in your blood. And if there's an abnormal amount, then you will be able to tell. Now, doctors can also perform a saliva test at night because people who have Cushing's disease usually have a higher amount of cortisol at night. Imaging tests can also be used to detect abnormalities in your pituitary and adrenal glands. A petrosal sinus sampling can help determine whether the root of the disease is in the pituitary gland or elsewhere. Now, the statistics of Cushing syndrome. Now, I have a graph here that shows that Cushing syndrome is about 3.5 times more common in women than in men. And now, Cushing syndrome is also more common among people in ages 10 through 49 as opposed to the other ages. And at this time, there are no differences as to whether ethnicity causes Cushing syndrome. And then, I have my works cited, and that's it.